My name is Vanessa Rovig. I work for Minot State University. I'm the director of the North Dakota Navigator Project, and my coworker, Kristen Michaels, and she's the tech behind it. So she's going to be running the slides and monitoring the chat, but we all work together. So that's our grant project. We do work through the North Dakota Center for Persons with Disabilities. So if you guys have any interaction with that, we're a grant program. And we do help, from birth to aging. So this kind of falls under that umbrella of supporting people with disabilities, but this grant might help a lot more people as well. So we're definitely able to answer a lot of questions with this, but that's kind of, the backstory of where we've got this grant. So we're excited. So if you guys have questions, pop them in the chat. I don't know if you guys want to unmute or anything like that, but if you have questions, definitely, put them in there and we'll answer them. We don't mind being interrupted because sometimes you might think of something in the moment. So we'll go to the next slide there. Okay, so for options for yourselves, you obviously have your spouse's insurance policy. That's a big one that people usually gravitate to, so they're able to look at that. Sometimes though, in that situation, it might be a little bit more money. It might be, you might want to just, look at other plans and see what options you have. If you haven't hit, that 65, to be eligible for Medicare, that might be a different option for you. Some individuals choose to go on COBRA. That's something Kristen and I definitely have talked about a lot, and something we brought up last week was that when we first started this grant, 3-4 years ago, the COBRA was, exponentially higher, and something that people were like, oh my gosh, I wish I'd never signed up for that. Obviously, the premiums have changed, with the marketplace or with private health insurance, and so a lot of people are looking at it, and all of a sudden, COBRA is not such a bad option. But we're there to help look at both options for individuals. So we want to make sure that that's, very clear. You don't have to go with that COBRA plan, but it's definitely an option for individuals, especially right after. Or you might be looking for an insurance carrier plan, so like the marketplace. So you might not be eligible for those premium tax credits, but we definitely want to make sure that you are aware of all the options. And then we also have Medicare. So if you're 65 and older, that's a really obviously you have to go to that program, but there's SHIP or SHIC. It's a state health insurance program, and that's the number there. And so that's where we refer out to people if they do have questions about their Medicare insurance. So, and Kristen, feel free to add anything. We are used to doing it kind of in person, so virtual we'll talk when we need to. So for marketplace, losing health insurance. So if say you retire and you want to look at your options, or you want to have it kind of prepared when you're going to do, if you're going to look at COBRA, or if you want to look at private, if you don't have access, maybe to a spouse's plan, maybe they're already on Medicare, losing coverage qualifies as a special enrollment period. So open enrollment is normally from November 1st to January 15th, and we're going to stick with that for now. We're not sure if that might change, but there'll be lots on our website, lots of updates, but keep yourselves informed of that because open enrollment does fluctuate sometimes. So you have 60 days before or 60 days after if you lose that coverage to be able to enroll in the marketplace. You cannot, and I cannot stress this enough, you can't just voluntarily drop your coverage. That does not qualify you. You would have to wait until that open enrollment date. So you want to be eligible, you want to be looking at that November 1st to that January 15th. So if you're putting anything in your calendar, make sure you know those dates. And it is different than Medicare open enrollment dates. I think Medicare's in October, I believe. Kristen, do you know the dates there? You might have already talked about it.
Yes, it's in October.
It's in October. Okay, perfect. So those premium tax credits, if you're not enrolled in retiree coverage, are definitely a benefit and something that we can weigh out. So it's based off of where you live, how many people you claim on your taxes, and how much income you have coming in. And so this year, most North Dakotans had the choice from about 30 plans to look at. So it's not just, outside plans. There's Medica plans, Blue Cross Blue Shield, Sanford. And again, we're not brokers, so we're not going to lean you one way, but we can definitely, from experience, tell you what other individuals are looking at, or other plans that people have chosen that continue to choose them, that are saying, we really enjoy this plan. This really helps my family out. There's certain situations that you might want to just talk through. We're not going to influence you either way. At the end, it is your decision of what plans you want to choose. Okay, so this is just a breakdown. There is a health insurance marketplace calculator. So if you guys are interested, this is, oh, where'd it go? You're trying to psych me out there, Kristen. Don't do that.
Sorry.
So that is something that is on our website. So if you guys have your phones and you want to get our QR code, though, I believe that goes straight to our website and you can check out the calculator on there. Now I want to stress, and maybe Kristen, you use this maybe a lot more than I do. It's accurate, but it's close, but it's not accurate. Do you want to you want to talk about that a little bit?
Yeah, so this calculator it's built by the KFF organization, but it basically you answer like 5 to 7 questions or something like that. So it's very simple. It's just like the size of your household, your age, and your household income. And it just gives you kind of this general idea, like what you see on the bottom here, based on just that annual income of what you might get for tax credits, and then therefore what like an average premium would look like. So it's kind of going to give you the middle range of those 30 plans. So there might be ones that are lower premiums and higher premiums than that. And there are other factors when it comes to those that you wouldn't see until you do a full application. But if you're just curious, like, if I'm going to do the marketplace, like where am I at? What does it even start at? This kind of gives you that starting point to know if you should even call us and pursue it further.
Yeah, or you can call and we can do it with you too if you don't feel
Mhm.
comfortable or you just want to talk through some scenarios. We have a lot of people who are maybe a year out, 2 years out. They just want to talk through their options, which I think is so smart because with this, and even from we can attest, like from us doing the grant, things change every year sometimes. Like things will change. So make sure you know you're going to, I don't know, it is healthcare.gov. Do not do healthcare.com. Make sure you're really going to the right site because we do have individuals that think they're signing up for a plan. Just make sure you're going and you're getting there. Once you go on the website, that healthcare.gov, so many good resources. And all of that, though, is on our website. And we have it broken down. So it's, I don't say want to say like local, but it's definitely more geared towards North Dakotans here. So do you want to talk about the chart, Kristen?
Yeah, so this just kind of gives you an idea, and this is a useful chart, whether it's for your own family or maybe you have, extended family or even still students, if you're not retired yet and you have students that are saying, tell you something that maybe their family or themselves needs coverage because they're going to become an adult. This is just a good reference chart to kind of give you an idea of where the federal poverty level lands, just because some of that data that you see on our website or on healthcare.gov will say like percentage of FPL or something like that. So there are instances where those numbers can come in, and this just kind of tells you where they land for the year. And they update this every April. So
Perfect. And also on our website. So there will be a
yes.
link on there. Yep, absolutely.
Yeah, and then that middle part there kind of just tells you like what's expected. Like depending where you land, this is kind of where your premium's going to land. So that kind of tells you where they get that average number that we showed you on the last slide.
Perfect. Okay, so all plans offered in Marketplace, and so just people sometimes get nervous, but they are all, Blue Cross Blue Shield, Sanford. They'd be just like getting a plan through your job-based insurance or anything like that. You do have ambulatory patient services or outpatient care, emergency services, hospitalization, pregnancy, mental health and substance use disorder services, prescriptions, rehabilitative, laboratory services, preventative and wellness services, which is always good to have, pediatric services if needed. Sometimes some plans do have adult vision and sometimes they have even just dental involved in it as well and vision. Sometimes not all plans have it, and it also have to make sure that your provider is covered under that. So those are kind of things that when we go through, when we complete your application, we'll add a list of your prescription drugs. We'll add the list of your doctors that you see. Because sometimes it might be like we've had tons of scenarios, and Kristen can attest or can say to this too, it might be, oh, I love this plan, but it doesn't cover my provider. Well, at that point, then you maybe have to make a decision. I really love this provider. This is really important to me. I'm willing to pay more for this premium so that I have the services through this specific provider. But sometimes you have to weigh it out, even if it is a year or two, until you hit Medicare and be like, well, maybe I can just wait a couple years and then go back to them or whatever the case might be, because this is out of, cost wise for me and my family right now. We want to look at something a little bit more low cost, but you can weigh all those plans out. There's lots of good ways on the website to break them down or show them side by side. You can compare up to 3 plans. So we really help you, kind of take a deep dive because every family situation is so, so much different. So we can help walk you through all those scenarios. Okay, so we talked about this a little bit last Thursday, so we don't want people to get caught up in like, I need a gold plan, things like that. I think a lot of people gravitate to that. They're like, I need the best of the best. That does not always mean that. And I think we like the slide next, don't we, Kristen, a little better. It kind of breaks it down a little bit better. That gold plan will have that really high premium, but it has low costs when you need care. Compared to the bronze, it'll have that lower monthly premium, but it might have higher costs when you need care. So I think everyone's family situation, your health needs are different. And so that's something to take into effect. So don't get caught up in, oh, I refuse to have a bronze plan, but maybe you don't need that high cost, that high monthly premium. Maybe you only want to use it, but you're like, well, but I have this, condition or this, thing that I maybe want to take care of or a surgery upcoming, things like that. So you want to really factor all of those things out. So that's something that we help with when we meet with you. And when we meet with you, it might be virtual. For this fall, it definitely will be virtual, but now until, about end of August, if you are interested in face-to-face, we can definitely set that up no matter where you are in the state. So we do have some travel funds right now. So anything to add to that one, Kristen?
Yeah, I was just going to say this is kind of, a very generalized group of metal levels that they like to call it. I just helped someone on Monday that was just kind of looking through plans, and the gold plan was actually didn't seem to have as low of costs. So it was very strange where the silver plan actually I don't know, it was goofy. You'd think it didn't look like this that you see on the chart. So it's really like kind of looking down at those copays and deductibles and then comparing it to your premium. And do you want to pay that premium up front and have lower costs later, or and just making sure that that's actually what it looks like. And we're even able to pull up like an explanation of benefits to say, hey, this is very detailed, 7-page sheet that they send you with your coverage of like, let's look, do they cover chiropractic care? Do they cover these other, specialists? What is the cost for a specialist? So we can really dig in deep with you on some of that extra confusing stuff.
Yeah. And everyone's family situation is so different. So that's where it's so nice to talk on the phone or even through email just to get a little bit of background information. And then we can really help support you and your family and what your health needs are. Okay, so we talked a little bit about open enrollment. So tentatively, it is November 1st to January 15th. That may or may not change. Things are kind of in conversation. It may be less. So I think if you are looking at, having questions, or if you're looking at retiring, closer to that date, or you want to just talk things through, reaching out to us about mid-October. We have a contact referral form on our website. You can call us. We have a 188. We'll have all our contact info at the end. You can, my number's on the website as well. You can contact me directly. And so it's really important to keep that in mind. I do want to note that's really important. Enrolled tribal members may enroll at any time. And obviously, if you have any of those special enrollment period, qualifications or eligibility, then we can look at different times of the year for you. So if you retire a little bit earlier, things like that, if something changes, because life happens sometimes, and that's why we want to make sure people feel as prepared as they can. We're here to educate and assist with that. So. Okay, so these are just qualifications for a special enrollment period. The biggest ones are obviously you have to move to a new zip code. That's a big one for changes in residency. If you're a student, stuff like that, moving to the US from a foreign country, loss of health coverage. So a big one is losing Medicaid is a big one for a lot of people that we work with. If you're losing your job-based health coverage, which would be more, eligible here. If you're losing eligibility for Medicare, which that one's kind of a tricky one, and we definitely would probably work and collaborate with the SHIP program on that one. Another big one, turning 26 and losing parental coverage. So maybe some of you guys have students that might be losing coverage, or maybe don't quite have access to a job-based health insurance. Maybe they're still in school. We can definitely help with that. The income changes, that would affect your coverage. Gaining status as an American Indian or Alaska Native, becoming a US citizen, leaving incarceration, things like that. So this is all on our website. It's just a really great way. So maybe not eligible entirely for yourselves, but maybe family members or friends that you know. And they can always reach out to us. We're very available to just have that conversation with them. And just at least give you a little peace of mind. And it's always better to call sooner than later. That's all I can recommend on that side of it, of any of these changes. So. All right, so this is our Navigator project. So this is our contact information. Is this our last slide, Kristen? No. Okay. This
I
is
think
just
so.
talking. You think
Oh,
so?
no.
No, okay. I was like, that's just our contact. So if you guys want to take a quick screenshot with your phone, or if you want to, if you had the QR code, all of our information is up on there. But this is just talking about our we should have this one at the beginning. This is us. We've already talked about this, but we are grant funded. So every year we're a 5-year grant. We're on year 3 of the or going on year 3 of the project, but we have to write continuation for it. So if anything changes, it would be up on our website, things like that. But you can check out the North Dakota Center for Persons with Disabilities on through Minot State, and you can check on the website there, or you can contact us anytime for that if you have questions or anything like that. But as of right now, we are funded. It will be myself full time. And so if you have questions, it will be with me, and it will most likely be virtual or over the phone. So if you do have questions, I encourage you to reach out sooner than later. It just helps because open enrollment gets a little bit to be a lot. It's a very, very and then especially towards the end, because sometimes you forget, and that's fair. We're all human. We have very busy lives. But if you do want to reach out to us, that's when I encourage you to do so. So probably closer to that October if you're looking at open enrollment. Okay, so for the first time that you're visiting, the biggest thing is that, we just need information about your household size. So this is just a checklist. We have this on our website as well. So making sure that you file taxes. So that's a big one. If you don't file for taxes, you will not be eligible for that premium tax credit, which really helps take that premium, and lowers that premium for you. And so just making sure that if you have a good idea of what you made the previous year, we can take kind of that. We can also break it down monthly. So maybe you're retiring and your income is going to look a little different for the monthly income. We can put that all in. Maybe you're going to pick up a side job or something like that down the road. We can always report a life change during the year if you complete an application, and we can help you put that in at any time. So don't ever worry. There's lots of people we work with, farmers, contractors, seasonal workers, things like that. A lot of people are very dependent on the weather for their jobs. So the income is we want to get it as close as possible so you don't have to pay back anything at tax time, but we also know we can make changes throughout the year if needed. So just keep that in mind because some people really worry about that, and 100% for good reason, but same time we can make those updates. That's real life. We can't just forecast the future or anything like that. We will need everyone who's applying for coverage. So if you're a tax household of 4, we will need everyone's social security numbers and birth dates, home and mailing addresses. If you do lose coverage, we may need a letter from that job-based health insurance, or if it's Medicaid, things like that. They are getting very good in a good way that you can't complete your application until you upload that. So make sure you're doing it ahead of time. Don't wait till the last minute or a day before the end of the month. Because keep in mind, say you retire in, I don't know, August or something like that, and you want coverage September 1. Well, we got to get that application in by the end of the month, that previous month, so that your coverage can start on the 1st. So that's the
Yeah, Lisa,
mace. Yeah.
I was just going to add, when it comes to the household size, some people get a little tripped up on that. I've come across it a lot in the last few years that that is specifically who you file your taxes with. So even if you have like adult children who are on their own but living in your house, filing their own taxes because they have their own job, as long as you're not trying to get them coverage, they are not considered part of your tax household.
Yes. Yeah.
So that's the
Good.
kind of stuff we can help people figure out too. If you call us and you're not sure what is your household considered, we have a lot of those kind of simple answers as well.
Yeah, absolutely.
Oh, that was our last one. So they were just a little bit out of order.
Okay. Oh, okay. That's okay. Yeah, that's it. So does anyone have any questions, things like that? Definitely, if you want to take a screenshot of our contact information, or yeah, write down our website. We have so many good resources. Kristen has done a fabulous job on our website and made things really accessible and easy to read and broken down. So for anybody that has questions, and we are free. We're all grant funded. We're not paid by the application, anything like that. We're just here to educate and assist North Dakotans. So if anyone has any questions, I don't know if there's anything in the chat there, Kristen, or at all, but if not, we are here and you know how to get a hold of us.